Good morning.
Good morning, Gene. Morning, Catherine.
Good morning.
It is still
Oh,
morning.
it is of saying good morning because
Oh, it's afternoon, excuse me.
Okay, you guys
It's
are
on
well
where
aware
it is.
Catherine's run the meeting today.
yeah, I'm gonna pretend I wish, but I'm not. So it is 1 o'clock. So I'm going to call the meeting to order. I'm looking at my computer because that's where all my notes are. Sorry.
Okay.
Does anybody have any changes or anything to the agenda?
Yes, I do. I'd like to see if we could move the capital expenditure request, which is item number 2 under new business, up first. Tiffany is here to make a presentation on that, and then she needs to get back to her department.
Okay.
That's the only change I had.
Okay. Anybody else? So, and then has anybody have any questions or concerns about the approval of the minutes? Any corrections to that? I didn't myself.
I didn't see any.
Okay. So with no corrections, we're just going to approve the minutes of June 30th, 2021 meeting.
Great.
Man, it seems like time is going by so fast.
Truly.
I don't see anyone from the public, but if there's anyone from the public that would like to make any comments, now's the time. And with none being there, we're going to go ahead and if she's ready, we can go ahead and let her do her presentation.
Okay. Tiffany.
Okay, so I'm putting in a capital expenditure request for the approved purchase of Sally, the salad robot. I've already taken it to the foundation and the board, and they have agreed that they're gonna pay for the robot and do 50-50 and split the cost. So I'm here just today to get approval of just the purchasing of it, but the funds have already been
Yeah, auxiliary is picking up half, foundation's picking up the other half. And so there's no out of pocket for the district, but because the auxiliary is technically a department of the
That's
hospital, we have to
Right.
be here just to get the approval for the board.
So do you want a lot of information on it?
Why don't you just
or-
briefly go through that, and if there's anybody, because some of them may have already heard.
Gene already heard the presentation, and we have the video if we need it,
Yeah, we can show them.
still on the video.
Right.
Catherine, did you see the video on YouTube?
Not see the video you guys have, but I went on YouTube and watched it a bunch of times, different ones,
Okay,
and just looked at the responses from different hospitals. And you know, there was nothing but pretty much high remarks. I didn't realize it had been something that's been available for quite a while. That was kind of surprising to me. So yeah, I don't have any questions about it. I'm kind of looking forward to coming over there and getting a salad. And so does the machine, does it take a card too? Is that what you guys were talking about before?
It will take a credit card, and then we're gonna also look into other ways of doing point of sale with like employee and then some
badges, yeah,
voucher
right.
coupons.
Stuff, okay.
Yeah, because right now the employees can go ahead and use their badge, and that will automatically deduct from their paychecks and so forth. So, which has been nice.
Do we
Yeah.
need a motion to put it on consent agenda? Or do we need to approve it? Or make a motion to approve it?
You can go ahead and do that if you want, George, or Gene.
George, all right, Bob.
I don't know where that came
All right,
from. I haven't even spoken to a George. I have no idea
You know
where that came from.
That, you know what, I thought that was very appropriate. Tell you, but perfect.
I make a
Now-
motion, we approve it.
Okay, thank you. So,
Excellent.
and can I second as a chair or no, as I'm running it?
I can do it.
You guys are
Okay.
really just approving it to be sent to the full board.
Okay,
It'll go onto the board agenda, so.
Would you like it to go on consent agenda?
I would like it to go on consent agenda.
Okay.
I'm
And
looking-
I'll second the motion. I can do that.
Okay,
So,
Tiffany, thank you for everything you're doing about getting that brought to us.
Go ahead.
you broke up there a little bit, Catherine.
Tim,
Oh,
about the, like $300 on the difference, does that have to get?
No.
Okay.
I was just thanking Tiffany for doing the research and bringing something like that to our facility.
Yeah, I'm really excited. It's been a long time. This process has been long, but the light is at the end. And I think the end result, having these salads and the salad bar alternative and just the access to the meals 24/7 for staff is
Right.
just so exciting.
Oh, it
So,
is. It is.
Yeah,
Thank
that's
you,
I
guys.
think, a big deal. So thank you for that, Tiffany.
yeah, thank you.
Appreciate it. And hopefully she's got a couple more of these lined up down the
I
road.
know,
that,
there's a lot of them.
that are a little different financing and so a lot more affordable, I think, for us in the long run. But this is a great start. I think that everybody
Yeah.
that we've shown it to has been very high on it. So we'll see.
Perfect.
Thank you. And thank you, Tiffany.
Oh, yeah, thank
Oh,
you
you're
guys. I really appreciate it.
You're all set?
Okay,
You are free to go.
that was quicker than I thought. Really quick.
Well,
You prepared so much for this.
I know, this is true. This is not the first time. Thank you.
Have a good. And so we're gonna go ahead and continue with the E then for the financial statements for June. And do it. Oh. He's talking in the background. Were there any questions on any of those financial statements? From any,
She's on letter E.
Oh,
on letter E, I'm sorry.
oh, okay. Got it. Oh, so you want me to go through those?
If anybody has any questions or not, we can go through those.
Okay. The, on page 9, just to look at, this is the assets, the balance sheet. Just, I know we don't normally go through that in finance committee. I think, we probably should take a look at that from time to time. So on page 9 of the packet, you can see cash and cash equivalents is sitting at $3,673,000. It was about $383,000 last month. And you can see where it was on the audited annual was $5,700,000. So we currently have, again, there's net patient revenue from the accounts receivable. That's another about $7,086,000. You can see what other receivables inventories are. So current assets totally sitting at about $12,000,001 against where we were June 30th was $9,006,000. So if you take a look at that at your total limited use assets, which is right below current assets, again, you can see cash is sitting at $338,000, $9,000,001 for investments. That's what you have in the LAIF account. $4,006,000 is our bond reserve fund. We have funded depreciation of $5,006,000, which is consistent with prior month, hasn't changed a whole lot. And then other limited use is $5,889,000. So brings us total limited use. And most of this stuff is money that's been set aside for the construction project. Some of this is money that's there waiting, the Medicare money waiting to see if we have to pay that back or not. So like I say, that brings us up to about $25,574,000 for total limited use assets. Again, plus another 12. So property, plant, equipment, $6,008,000. So all totaled unrestricted assets, $44,542,000. So against the the audited year end of 29.5. So it's been obviously some considerable increases to our assets this year. Our liabilities, likewise, you can see where we're at there. Our accounts payable is basically, right about where it was the month before, $1,875,000. Third-party payers is 13,996,000. Some of that is your IGT money. That, again, is how they book that. Some of that will all be adjusted once the audit is done. So total current liabilities sitting at 17 million versus prior year of 15.5. Long-term debt, obviously 14,178. Some of that was the impact of the new note that we had done for the paying off the old bonds and so forth. And so then we also have under other long-term is the HHS Medicare Advantage payment. That was at 6,264,000. That's technically on the book still, but it's got to be on both asset and liability. That's what we potentially risk to have to pay back if that's not forgiven by Medicare. So all total, our total liabilities are sitting at 38,163,000. And then when you add your total net assets in, you end up with the total liabilities and net assets of 44 million, which balances obviously to our current assets or to our assets. Next page, page 11 is the actual.
Tim,
Yes.
where did you come up with those numbers? I had a call from a doctor whenever you first started, and I had to get it.
Oh, these are just the balance sheet numbers that come from Barbara.
Okay, well,
Which numbers?
the money that we've gotten in the past year
Yeah.
from IGT primarily,
Yeah.
or PPP or IGT, it's all, money.
Yeah.
Now, when they send us those checks, do they just send the checks and say, here's money? Or do they tell us what it's for?
They pretty much tell us what's for. A lot of them, the IGT monies, some of them come as checks. What we get from Current Health Systems and from HealthNet come as a check. Some of the other government payments that we receive for quality payments and those kinds of things come as a direct deposit to our bank account. And so Barbara will get a notice that comes through usually with a 1-line or 2-line description of what it's for, like IGT or like quality payment or something like that. So that kind of notifies us what it's for. So then usually there's emails before that we kind of know, because they're going back and kind of estimating what those fees are going to be in advance of us actually receiving the cash. So.
Can't we get a little information when you show, we got a $4 million check? And I'm not speaking as the chair now, Catherine is, but as just a committee member, but I'm just asking, can't we get some information on what it's for, since there's so many variations in the past, it's been pretty simple.
Sure. Yeah, there's, like I said, there's multiple places that we get cash from. Like I said, obviously, one used to be the Prime project. That's now called the QIP project. And where the Prime would usually net us to a max of about 750,000 a year. QIP, with the metrics that we've chosen, we have a potential there of $1.3 million per year for 5 years. So that went up considerably. But yes, I mean, absolutely. I mean, Finance should be able to give us a list of everything that's come in. Like I said, I know they're including at the bottom of the page here, the notes as to, how much has come in and how much has gone out. But yeah, I mean, we should be able to have an ongoing schedule of these supplemental payments as they come in so that, we're all familiar with what's gone on and where we're at and what's anticipated. So I can work with Barbara on doing that.
And who did the report that you're reading now, Barbara?
Yes.
Do we have any idea?
What's that?
Do we have any idea whenever Chet will be available?
We don't at this time. He is still recovering. I've been in communications with his wife. He is doing better. Still trying to get him home. And at this point in time, but I can't say much more than that at this point.
Yeah, that's fine. That's fine. I wasn't asking about Chet. I was asking about his position.
Oh, I'm actually
when
working.
Is he going to be back filling it?
Yeah, I'm actually working on some additional support for Barbara in the way of interim help until Chet is able to return. And so I've been in contact with Whitfley. I've been in contact with Rick Jackson. And I've got another company that I've got to contact this afternoon who does this. They're a national company that provides interim and transitional support for financial people. And so, you know, but as I get more information, then I'll keep you guys apprised of what's going on there.
Oh, okay, thank you.
You're
Sorry, Catherine, for taking over.
Yeah, you know, next time you say, can you run the meeting, you just need to let me do it. Just kidding. Hey, back to the first question though, about like where the money's comes from. That would help me immensely for a while if I see, you know, because I know we report the numbers, they do good at reporting it, but just seeing where it comes from, or, you know, their little description or emails that she gets. But I can also talk to her.
Well, if you're having questions, obviously some of the other board members are too. So, I mean,
Yeah.
You know, it's money that's coming into the district. You're the fiduciary board, you know, you should know that.
Yeah, thank you. I think it would really help me. I'm glad that Jean brought it up, because I was going to ask before, because I can look at these numbers and stuff, and I know they're incoming, outgoing, this sort of stuff, but it's kind of nice to have a little more knowledge under my, well, I don't even wear a belt, but you know.
Agreed.
So
I feel the same way.
would just help. And so anything else on there? We did the unaudited, the supplement, we did the supplemental part of it, right? Did you do that?
Yes.
Okay, that's what I thought. So, but my question is there any questions on the local vendor aging? Jean, do you have anything that you want to cover? That's on page 23. Things are looking really good, you know? So
Barb and I are meeting on these, and we're kind of trying to go through these, you know, in light of the goals that the board set for me. You know, we're going back and taking a look at the whole AP run to see what we can do about getting those that are over the 90 days or the whatever their term is plus the 45.
right.
Get down to those levels. So we're working on a plan to try and get that accomplished. So,
Okay.
So anyway, that's in process.
Just one question. I'm not related to the propane, but the propane billing.
Yes.
Back in April or so, or March, we weren't going to be ordering any more propane, but every month we're paying $7,000 or $8,000 for propane. Were we in arrears on propane?
That I don't know. I'll have to find out on that one, Gene.
And can we put that on? It should have been, I would have thought, on the local.
It may have been. There may have been some arrears on that. I can't tell you. There are some ongoing propane purchases, obviously, for our other buildings and so forth that may be totaled up to something close to that. I don't know.
Okay, all right, it's not a big deal. Can we put it on local vending?
Oh, yeah. Well, we'll be now, the Kern River. Well, Kern River propane is actually on here. And you can see that on page 23, and it's got 00000 there. So,
oh, that's cool.
Yeah. Okay.
All right, thank you, Tim.
You're welcome.
It's not a big deal. I just wanted to.
It may be a thing where they just bill us monthly.
They do. Yeah.
Yeah, and then they're going to start in October, correct?
Correct. Yeah.
Okay.
They came out last week and they inspected the tank. They realized, yeah, we still have, you know, around 70% fill in the tank. So, you know, I asked them, okay, well, you guys give me an estimate as to when you think we should be ready to start. So they said October 1. So that's what we put on the contract. So
okay,
that came from them.
that's perfect then. So then I don't have any old business showing, so we can move to G for new business.
Okay.
For the contract reviews and renewals.
$66,244.
Tim, are you doing all this?
It's me and Heidi or Mark. It's so yeah, most of it's probably falling on me.
Okay, well,
We'll do the best we can. So Barbara put this in, but Barbara's on vacation this week, so.
right. So
um,
I actually reviewed all these. I don't know if anybody else has. There wasn't anything that I had questions about.
No.
Because from listening to the different things, the only one I had a question about, if you guys don't mind, if you don't want to
Sure.
go through each and every one,
Go ahead.
but the the Women's Center High Desert,
Yes.
what do we do for that?
We don't do anything. What they do is, it's like a transfer agreement that we have with them. They provide us with a means, if we have someone who comes into our ER, someone who's been battered or abused, it's basically a shelter. They come in and they can certainly do the rape testing if need be. They do that level of service, but they also provide.
No, they don't do that.
I thought they were, oh no, that's going through Kern.
They got to go to Kern Medical.
Kern Medical.
They just
Okay.
provide.
They provide the
just
housing.
Provide resources for somebody who's been in a domestic violence situation.
Christy Litton was over at the hospital just last week.
Okay,
Investigating a complaint by a male about a female that was his wife, spouse, that was
Really?
attacking him. So we do call Christy on occasion when there's a spousal abuse of some sort.
okay,
They also provide housing over in Ridgecrest for these people if they need a place to get away.
yeah, I knew that they had that. I just didn't know if that included like, do we do any transportation for them? Or if we have
They
to
do
get
it.
them somewhere?
Not
They
that I
do
know
it?
of.
It's just calling and they'll come in and sort of arrange with the patient, whatever their needs might be. So it's really just connecting them with that resource.
Yeah.
Okay, so that's good.
Catherine, when we do get our
The bands?
transportation, there may be opportunity for us to help provide some of that though.
Yeah, I guess I think about, if there's gonna be like a long wait time for somebody to be able to come and pick them up if they're going. It seems like we could cut that time in half or so if there would be,
I can't
A
remember
way
if the
we could-
sheriff has helped out in that regard or not to bring them over there.
I don't think the sheriff helps it
No.
much, you know.
I honestly.
I didn't know if they
where
did
we
or not.
called For them as a resource and didn't have them show up right away. Their response time is quite good.
Yeah, they have somebody, I believe they have somebody here in the valley that's affiliated with them over there.
Christy Lewis.
That's Christy, yeah. And so forth.
Yeah.
But the main facility is over in Ridgecrest.
Okay,
So
Well-
we've gone out there to visit that and so forth. It's a pretty nice service they provide.
yeah, and we're lucky to have it. It
Yeah.
would be nice if we could have one locally too, but you can't do everything. So that was my main question.
Okay.
Jean, do you have any questions?
No, that,
Okay.
just back to the propane for a second, Tim.
Yes.
Okay, my understanding is it will not need to be filled until October 1st.
Correct.
So the other company will not be filling it before October 1st.
Correct.
Okay,
Yep. Yeah, matter of fact, yeah, I've got Bob notifying them that, we're terminating that contract and so forth, so.
What
but there'll be no
contract?
question,
Terminating the agreement.
terminating the agreement. What did I say?
Okay. And contract.
Agreement, yeah, it wasn't a contract, yeah.
So, and we're doing that in writing, right?
Yes,
Okay,
yeah,
Um,
things we try to always do in writing.
okay. So as far as the new business on there in number 1, again, I've reviewed it. I don't have any questions. So does anybody else? John, do you have questions or?
I can't say anything, Catherine.
I know, but still, I just, we consider you part of the public sometimes. Just kidding.
Thank you.
But because it's, most of these, we have, they're ones that we stay on top of most of the time and we know when they're coming up as far as the contracts and the renewals.
Right.
So,
One of the things that will be an issue going for us, going forward from here, as you may or may not have heard, the state just came down with a new public health order that is going to take effect on August 9th. hospitals have to be totally compliant by August 23rd. But what it's going to require now is for all unvaccinated employees, and employees are defined by paid or unpaid. This includes doctors, this includes nurses, housekeepers, billing people, administrative people, you name it, everybody, volunteers, anybody who is technically, quote unquote, working in the hospital who's been unvaccinated must get tested twice a week. And so, like I said, right now, our SNF staff are the only ones that have been mandated to go through a weekly testing regimen. And so this is now upping that to twice a week for those that are unvaccinated. There's a conference call on Friday that Mark's going to lead with some of our staff as to how to roll this thing out. This is going to add a considerable amount of expense to the hospital. It's again, another one of these unfunded mandates that the state has put on us that is going to be big, but it's something that we have no choice. This is a mandate.
So, and if that's going to change the part about, it's not going to change the renewal or contract with the Westpac. Are they the ones that we provide that?
We've been using Quest for most of our testing, which Quest charges us about $100 a test. Westpac is charging us, I believe, $70 or $80 per test.
Yeah, 70 is what it says. Yeah.
Right. So we're moving that over, trying to move as much of that over to Westpac as we can to save as much money as we can. But Rebecca and I were looking at that yesterday. If we figure we've got probably 110 employees who are unvaccinated at this point, and at twice, if all of those have to be tested at twice a week, you're looking at about a little over over $800,000 in additional costs to the district at the $70
Annually.
Right.
Not to mention the time of all the employees getting tested, plus
that's just for the testing.
That's just for the testing
to be run, let alone the staff time to get all that stuff done. So you're looking probably close to $1 million a year just for that one mandate. So, and the state, that's your responsibility. We don't care. We're not paying for it. So
and that falls on the hospital.
Yes.
We can't have them go to the lab and have their insurance pay for it.
Well, that's interesting you say that. I was on a call with the hospital association yesterday, and they said that there may be some give on that, whereby because OSHA was coming out, Cal OSHA was coming out and say, no, this is a mandate that's on the business, therefore the business must pay for it. But apparently the hospital associations, there have been some communications with the state where they may allow some of the hospitals to go and bill the patient's insurance. So we don't know where that's at yet, and I'm hopeful on Friday at a conference call, they will update that for us.
Tim?
Yes, Chief.
It has to be medically necessary to be paid for. That's not medically necessary. That's financially necessary or whatever.
Right.
But I don't think that would be considered medically necessary.
COVID testing was one of those things that was mandated on the insurance companies that they had to pay for.
And actually it is medically necessary because it's a medical doctor that actually wrote that health order.
Right. So, yeah, this was written by the chief medical officer for the state of California.
And it seems like because it's a personal choice that they're choosing not to be vaccinated, then it should be a personal debt to them.
That's what I said.
Mark had a great idea. He said, his point was, he said, well, listen, if it's your choice not to get vaccinated, then you should pay for the test to get tested, which I thought was wonderful. And, but then, the state came down and said, you can't do that. So.
Can't do that.
No.
Well, because that would save a lot of money.
Oh, absolutely.
That's going to be a big expense.
The whole point of this is truly, and they've said so much, this is a means to entice, and I use that word
lightly.
Well, it's a coercion effort. I mean, the whole point of this is to try and force more unvaccinated people to get vaccinated. I mean, that's really what they're trying to do. They're going to make it a pain in the butt for someone to go and get tested twice a week. You know, and I believe that we will probably have some of our employees who will probably say, okay, this is not worth the effort. I'll just go do it. My guess is those that have chosen not to do it, this isn't going to affect that. You know, they'll just do whatever they got to do to not have that done. So, you know, again, this is the state and their infinite wisdom. And again, this comes like a day after a day we're going to do the same thing. So, you know, I just don't know that it's going to actually change anything, you know, in the grand scheme of things. But it is unfortunately an order that we have to follow.
Hopefully they'll put money towards it. I doubt it, but it was, you know, you never can tell. Yeah, because that's just a burden.
My conversation with the hospital have been very clear. They are not paying for it. So those questions were asked through a hospital association. So.
Well, it's going to be a burden on the hospital either way. And yet here they mandate things for us that we need to do, but they don't make it easy. It's like they're just trying to stop us from succeeding, not just us, but other, you know, hospitals or anywhere else. So,
you know, some of the arguments that the hospital association put forth and so forth, this is, listen, you didn't mandate this stuff during the peak of COVID. You did not mandate these things to happen. And now, you know, things have calmed down quite a bit, albeit that we're seeing a little bit of a pickup now with some of the variants and so forth. And so now they're coming down with these, you know, these difficult mandates, you know, for us to do. So yeah, it's concerning for a lot of folks. You know, again, we're a small hospital and we're looking at those kind of dollars. I mean, you take a look at, you know, Memorial Hospital's got over 2,000 employees. You know, Kern Medical, 2,500 employees. You know, you're talking some huge bucks for some of these facilities. So not sure how they're going to do it.
And my other question would be, does it really cost that much to do the test?
Yes, that's just the cost to run the test.
To run it.
We're looking at some possibilities of utilizing the one thing that they did do, which was helpful, was they're saying you can either do it as a CPR test, PCR test, excuse me, right letters, wrong order, or an antigen test. And the PCR is, that's the one we send out. We do have the ability to process antigen tests in-house. Those kits are provided to us free, but there's some labor obviously associated with running those. And so we're going to have a meeting next week with our staff to sit down and figure out, okay, what's the best way for us to do this and how can we handle this? And, you know, how often, you know, because there's still a lot of questions come up. Says, okay, you know, I've got an employee who works 3 days a week, but I've got to test him twice a week. How do we do that? You know, there's still a lot of answers to questions out there that we don't have. And so, you know, hopefully, like I said, hopefully with this conference call, we will learn some things on Friday that we can sit down and discuss next week in terms of putting an operational plan together that will allow us to do this and do it as cost effectively as possible. So that's our goal. But, you know, lab doesn't have the ability to run these in batches. They have to be done one at a time. And so that creates some issues. Now, one of the things, excuse me, when we get our new chemistry analyzer in, chemistry analyzer does do a serum antigen test that will allow us to do them in some batches. So that will hopefully help us, you know, but that won't be till like August, September, somewhere down that line. But, you know,
well, maybe the mandate will change by then.
I sure hope it does, but I doubt it.
Yeah, I doubt it too.
So anyway, so we're looking at some options that, you know, again, that'll hopefully get that cost down for us.
Yeah, especially when even they're showing that those that are fully vaccinated are coming down with some sort of variant of it anyway, just not being as sick. So it's kind of redundant.
Right.
I think, but.
Well, a lot of us do. But, you know, we're not in those high positions to have a say in that stuff, unfortunately. So, But anyway, we will do the best we can, obviously, to figure that out. We will share that with the board, whatever we come up with. Like I said, and hopefully the hospital association will continue to put some pressure on them to do this. So we'll see.
Well, that would be good. So my next question then, as far as the contract review and renewals, can those we send to consent for the board?
Yes.
Okay. If no one has questions, Jean, if you didn't have any questions.
Nope, thank you, no.
Okay, number 2, capital expenditure request.
We just did that one first.
That's the one we did first. And that one is, I'm kind of looking forward. How long does it take before we get it? Do we know?
She said about 3 months. And Bob has some things he has to do in the dining room for where we're going to put it. There's a space between the residence dining room and the staff dining room, and there's a little alcove there that has a stainless steel countertop. We're going to take half of that countertop out, put it in that space. It already has water and electric there, so
Right there. Okay.
not a big deal. It'll be simply making a cut in that stainless steel, putting it there. No wash pod requirement.
Yeah.
We just won't tell.
That's nice. So residents gonna have access to that?
Yes, everyone will.
Yeah, everybody will, yes.
The reason
Okay.
we're putting it outside of the kitchen itself, the dining room, the cafeteria area there, is so that it will be accessible 24 hours a day.
Okay, all right.
Residents can put in their own card, or we can have vouchers. So if a resident wants something in the middle of the night, they can, I don't know, purchase a bingo voucher and be able to buy a salad with it or something. We can certainly do something like that.
Right.
And then my next question, since we didn't need Tiffany to answer this, I don't think, but as far as cleaning on the outside of it, because if we have not only staff, but public and residents, I've been there. I know where people's hands have been.
Yeah,
So
Tiffany's on top of all of that, as far as I know. She's setting up a whole, I would say a regimented cleaning schedule. Let's put it that way.
That
Where
sounds
it's gonna
good.
be cleaned and maintained, yes.
She's coming off a 100 score on her cleanliness for her kitchen.
Yes.
Got her A. So she's very cleanliness minded, first of all. But and there's some substantial training that comes with this machine for the staff on how to clean this thing and so forth. Is to be done several times during the day. It's not just a once a day or once a week cleaning.
Right.
Constant. So for that very reason. But the nice part about it is you don't get your hands in where the food is.
Well, that's true.
Protected, and you slide your bowl in there and it comes down.
The training is $900.
That's right.
Of the cost.
Really?
Yeah.
Wow.
It's extensive.
Wow. Well, I hope it's worth every penny.
I do too.
So I guess my thought is just people's hands, what they're going to be pushing or whatever. That's kind of, I don't know if we should have like wipes, there so people can wipe it off before they want to use it or after they use it, like they do with other things. So
we'll have an alcohol, we'll have the hand sanitizers right there next to it and stuff like that, I'm sure.
She's already got it under control.
Yeah, I know
I have no doubt. Okay. So with that, does anybody have any other new business or anything that they want to talk about?
You
Besides
run
how
a mean meeting, Catherine.
listen, here's the thing. Here's my thought process. Heidi sends this stuff out. It's up to us to look at it.
Yep.
So if I look at it and I don't have any questions, then put it out there for somebody else. And I'm not real big on, if we have to touch this and talk about the same thing over and over, we're not making very good time management or progress. But
Agreed.
that's just me. So
Appreciate that.
yeah, I figured with the knowledge that we have that's sent out, if we have any questions beforehand, we could talk to, you or Heidi or Mark or anybody
Right.
that, or each other. Well, okay, not just each other because we're only allowed so many, but finance is tough. And so I try to take it very serious as to look at this stuff. If I have any questions, the renewals and stuff for the contracts, they're pretty straightforward. If there was a problem and we didn't want somebody to be renewing a contract, well, then we'd be discussing that. But yeah, I'm all about let's do it and move on. So anyway, Jean, do you have anything you want to add?
Nope, except that you've done a wonderful job. Thank you so much for your help.
Right, thank you.
You're very welcome. Okay, we're going to adjourn the meeting if no one else has anything.
Thank you much. Take care.
You're
Thank you.
welcome. You're welcome. Bye.
Bye.